Hello everyone, my name is Dr. Nancy Masiha from Belridge Chiropractic. Today I'm going to be showing you one of my most recommended stretches. It's basically for a muscle called the upper trapezius. Most people would normally come in with some neck and shoulder pain, typically around this area here. So basically the upper trapezius starts from the tip of the shoulder and goes all the way to the base of the skull. So when we're trying to stretch a muscle, we pretty much imagine where the fibers of the muscle would run. Okay, so the fibers are literally like connected sort of stretchy strings together. And when we're trying to stretch them, literally we are trying to separate and elongate those fibers so they can relax instead of being tight and stuck. So pretty much putting the upper trapezius into a stretched position involves turning the head away from the side that you want to stretch. In this case, it's my left side here. And we're looking down, okay, towards the floor. And you're adding a little bit of overhead pressure downwards, okay? So the stretch should feel like a nice, gentle pull. It shouldn't be like a very hard or a fast stretch. Some people actually try to bounce on the stretch and pull their head and kind of try to tug. Please don't do that because that will probably cause some irritation in the neck. So basically keep in mind that doing a stretch, you need to probably hold it for about 30 seconds, and I'd recommend this one about 3 to 4 times a day. Keep in mind, stretches are always preventative and they help keep the biomechanical function going. So if you already are presenting with headaches, a sore neck, sore shoulders, it's a matter of correcting the biomechanics first and then doing the stretch to keep the effect of the adjustment, rather than if you're at the stage where you are symptomatic and you're trying to do a stretch, it probably won't go very far. Because if I could just grab my spine. So pretty much when we adjust the spine, we've got these lovely little joints here. So the facet joints have a little space between each of them, okay? So it's a little tiny space, and that space is full of synovial fluid. If it's healthy, that fluid is like supple, it's nice, it allows nice easy movement of the joints. If it gets irritated or inflamed, that fluid becomes a little bit more thick and gluggy, and so that movement is not nice, it's not pleasant. You might turn your head and it'll catch somewhere, it might be painful, it might twinge, or you might just have a headache. You might not even have pain locally in the area that is not mechanically working, and that's where the expertise of a chiropractor will be beneficial, because literally we'll just find the biomechanical dysfunction and we place our hands and gently see if we can correct it. So that correction will also affect how the local nerves work as well, and it will actually also give feedback into the local muscles to allow them to relax. So keep in mind, stretches are a repetitive process. It's kind of like, when you go to the gym and you can't just do a really good workout session of, bicep curls and your bicep is going to magically become strong or bulky. You need to repeat that session several times. So doing stretches is a repetitive process. Pretty much anything when you're coaching and guiding the spine to change its function, so even adjusting is a repetitive process, because we are moving something and we are trying to reteach it to do that. And naturally, if you've had an injury in the past or if you've had some issues in a certain area, your local muscles and the joint function will always try to revert back to tighten or to protect you from having too much movement. So what we're trying to do is coach and guide the biomechanical process as to how the bones are moving and how the muscles are functioning, to change and to work in a slightly different way, kind of like going to the gym when you're trying to change how your muscles are contracting and basically training them to do something different. Thank you so much. I hope my video has been helpful, and if you do need the care of a chiropractor, please don't hesitate to find one. Thank you.